Pastor Newman?
Yes, I'm not hearing you either, Pastor Newman. Can we just make sure the host has unmuted Pastor Newman, please? Thank you.
Can you hear me now? Wonderful. Let's start all over again. Thank you, Nancy, and to all of the members of this august body. We're so thankful for the opportunity to come before you tonight, representing not only the medical community, but the leadership of the city and citizens in general who have a shared interest in what's going on in our community. As a faith partner, a person of faith, one of the wonderful things, if I can represent all faith communities tonight, irrespective of the belief systems, one common denominator and one thread that runs through our faith community is we love our neighbors as we love ourselves. Love is the singular thread that runs through and is a common denominator of all faiths. And it is in that spirit we are thankful that we can share this information tonight because it is out of love. No condemnation, no politicization. It's about love tonight. And we're so appreciative to be able tonight to hear from someone who has gone through what's happening in their own experience in the person of Mr. McAvoy, Fru McAvoy. And Fru's got a powerful story and he's going to hear it now. So Fru, if you would share it, we would be so appreciative. Thank you.
Absolutely. Thank you, Pastor. And thank you, everyone, for being here. Just being here and being able to speak to all of you is beyond humbling. And as the pastor said, you know, the love of our friends and our neighbors, our family, and our community, and just to be able to speak freely. This is so important. You know, like the pastor said, and you know, I'm 33 years old, and always been in the health industry. Always maintained my health, and I was struck very hard on June 24th, and it definitely changed my life and my perspective of how I view this virus and what should be done moving forward, and what I can do to hopefully help. You know, I want to keep it brief, but directly to the point. Like many others, I was skeptical. I was skeptical of the vaccination. You know, I actually asked some good friends of mine how they felt about it as well, and a lot of them responded. You know, they thought it was over dramatized, and you know, it was just another set of flu or something just to press more and more on the news. And you know, my best friend lost his 29-year-old brother while I was going through COVID, and it changed his whole perspective as well. However, you know, woke up June 24th with a small sinus infection, felt like allergies. Honestly, had no intentions on thinking anything else. Just a normal day. Would not have gone in at all to the emergency room if it wasn't for my girlfriend to get tested. I did test positive that day. I did go home that day. I was sent home with a finger pulse oximeter, which reads your oxygen levels. And scariest thing happened, and how fast it happened. Night of 26. So we're looking at 2 days, 48 hours. 48 hours. And I would not have gone in. I really would not have gone in. My oxygen levels had dropped to 56%. I developed, at the time I didn't know, but pneumonia. And next thing I remember is my girlfriend calling 911 and was rushed to the hospital. And I vaguely remember much. One of the scariest moments of my life. Next thing I remember is waking up and just tears in my eyes, not knowing what's going on, mask over my face. Nurses, doctors working hard, asking me, how I'm doing different tests. And all I could think about, where's my girlfriend? Where's my family? What's going on? Things escalated even quicker. I believe on the 2 nights later, I was rushed to ICU, put on a high flow nasal, basically to keep my oxygen levels up. I remember the doctor letting my father know, things are going downhill pretty quick. And I remember sitting there praying and thinking about my family and friends, and just, gosh, what I would do just to hug them and hold them and tell them how much I love them. And, I have a 2-year-old daughter, but never in a million years, never I would ever thought it would happen. And I'm also faithful, and I'm a Christian. I asked God, there was a purpose of why I went through this, but also what he wants me to take from this. And 100% is to spread the word within our community, because our community is our family, it's our friends. And I had to go to an appointment, and I noticed so many people without masks. I am not going to sit here and say that I wore my mask every single day. I'm not going to say that. I didn't wear it every day. I said, oh, I'm fine, I'm healthy, I'm young, it only affects the elderly or people with health issues. No, that is not the case. It's not the case at all. I remember being in there and the doctor saying, at Baptist Beaches, our ICU rooms are filling up quickly. And all I could think about was praying and getting out. And if there's one thing I can tell the people out there, and I truly mean this, and I will continue to spread this, because Jacksonville is my home, it is my community, is please, please protect yourselves. Wear a mask, get the vaccination. And as community leaders, let others know. I mean, it's our responsibility to let others know. You just may save a life. You really may just save a life. And it's something I would not wish on anyone. And I think what's going on is just like myself. I got up, thought it was a cold. I would have went on with my day, would have went on a few more days, probably would have spread it to others. And that fire would have continued to burn, and it would have continued to spread. So if you have any signs of symptoms, because I noticed, because my girlfriend also had COVID, is is the symptoms were completely different from her and I, completely different. And if it wasn't for her saying, "Hey, let's go in, we need to get tested seriously," I would not have gone in, and I can't imagine how many people I could have infected. There's such a misconception on the fact that it's affecting just those that are elderly, that have health issues. You know, being a personal trainer, a health coach in the gym industry, working out daily, never in a million years. So this has definitely changed my life. I'm grateful to be here, grateful to speak about it. And I just thank you guys for allowing me to share my story. I really do. So I'm out now. I'm on oxygen when I need it, but I am recovering, doing well. You know, working with pulmonary, respiratory doctors. I cannot thank all of you guys, all the doctors, scientists, everyone at Baptist Beaches for everything you guys do. So please, please, please continue to spread the word, because it's growing and we got to put this fire out now. Thank you.
Thank you so much for sharing such a heartfelt story. If you didn't feel that, check your pulse, people. What a powerful story, and it is your story to tell, very personal and private, but you shared it for the common good tonight, and we all benefit. We have a phenomenal panel tonight, and Fru has just opened the gates wide. And I'm going to ask Dr. Mo Reza this question kind of in two parts. There are people saying, you know, I thought COVID was over. You know, we're open, everything seems fine. And, we're even being told by the CDC, if you're inside and you're fully vaccinated, you don't have to wear masks. And obviously, Dr. Reza, that's not the case. And if you could, after you share what you want to share in terms of your data information, could you also address what's happening in our hospitals and facilities right now in Jacksonville? Dr. Nancy said, Duval's on fire. Could you help us understand what that means? Thank you.
For sure, Pastor Newman. Thank you for allowing me to speak. So, as an infectious disease specialist and as a hospitalist working on the front line, and more so as a father of 3 young children with a 4th one coming, all of whom cannot be vaccinated at this point, I wish I could tell you that COVID is over, but it's not. We're seeing it in our hospitals. Patients coming into the hospital are now younger. They get sicker faster. That's what we're seeing. And it's been a barrage for the last 2 to 3 weeks. The reason why that is we're dealing with a virus that's so much more contagious. The Delta variant is what we're seeing across Northeast Florida spreading. And now it is the most common variant across the United States of America. I mean, this virus is initial COVID on steroids. That's the only way I can describe it. It's 200% more contagious than the original COVID-19. And when somebody is infected with this variant, they produce about 1,000 times more viral particles in their lungs. So that's why they get sicker quicker. And they're also producing many more viral particles. So they're infecting more people around them. That's what we're seeing firsthand in the hospital at this point. And it's heartbreaking because at this point, this is preventable disease and death. It really is. When we see families admitted to the hospital, every room, same last name, just breaks our heart to see this young people in their 30s and 40s. So that's why we're seeing a large uptick in the hospitalizations across Northeast Florida. I'm going to share just a couple of quick slides about what we're seeing within Northeast Florida at this point. If you can all see that slide. This is from covidactnow.org. I encourage everyone to go on there and look at this data as well. You can look at for any county that you live in. So this is the data that's looking at from the healthdata.gov. And if you look at where we are now in Northeast Florida, in Duval specifically, we're at 85% capacity in our ICUs. I know others in the front line are saying this is rapidly expanding the number of patients we're seeing with COVID-19 infection, and then they're coming in quite ill. And majority of them are unvaccinated. This was something that was shared yesterday from Baptist Health. And I applaud them for being transparent and talking to our public, saying 97% of our admitted patients are unvaccinated or not fully vaccinated. But the striking part out of this is 44% of those with COVID this month are 40 or younger. That's just heartbreaking. These are people in the prime of their lives. These are people with children, with families and dreams, and that's just, and this is all preventable. This is looking at positive test rates in Duval County at this point. And if you look at it, it's about 22.8. And if you look at the peak back in July, we've already surpassed that. And this is putting it all together. And this is also daily new cases that we're seeing per 100,000 residents. You can see this bar here. It's just striking. It's shooting up. It's 66.2 per 100,000. Thank you, Pastor Newman.
Thank you, Dr. Reza. I heard Fru mention that he's young and healthy, and that's a question that's being raised. And Dr. Coward, if you could address this question, please. People who are stuck on the fact that they're young and they work out and so forth and so on, after hearing Fru has said, how do we make that message penetrate and saturate those who are younger and think that they're impervious? How do we address that to them?
Yeah, thank you, Pastor. We absolutely hear from people just like Fru, who are young, who are healthy, who think, I take vitamins, I have a strong immune system, I'm not that worried about COVID-19. Maybe like him, they're a little skeptical of the vaccine, but they don't think they need it because they don't think they're going to get that sick. And I just want everybody to hear Fru's story and know that every one of the doctors here, we know that Fru is not unique here. We have patients just like him every day in our clinics, in our emergency rooms, in our hospitals, who are young, who are now suffering, who are struggling to breathe, needing oxygen, coming and staying in the hospital, incurring high medical bills, struggling to learn how to walk again and care for themselves again while struggling to learn how to breathe. Just watching people suffering, whether they're young or old, is so hard for those of us who work in healthcare. And I think that's something that all of us here share, and everybody who's seen somebody suffering is, that's something we want to prevent. And so I would just encourage everybody to hear what Mr. McAvoy had to say and know that he's not alone in this. Just like Dr. Reza showed, Baptist Hospital, almost half of the patients that have been hospitalized there are 40 or younger. Now, we want our elderly patients to be protected as well. We all have parents and grandparents, and everyone's life is important. But knowing that you're young doesn't protect you from this thing, and you can still suffer. And death is obviously the worst possible outcome, and we don't want that to happen. But short of that, going to the ICU is suffering. Knowing that your family is scared for you is suffering. Being unable to breathe for a prolonged period of time is absolutely suffering. And so I just want everybody to hear from his story and from the doctors here to know that you can be young and healthy and you can still suffer from this illness. And that's why we're having this meeting tonight to talk about vaccines and masks to try to prevent that suffering. Thank you, Pastor.
Thank you so much, Dr. Coward. Our young people, our children are getting ready to go back to school at some point in the not too distant future. And that raises another question because, people have been saying, children can get it, they're immune or whatever the case may be, whatever information they've gotten a hold of. But we need to hear from a pediatric specialist, and we have one tonight, Dr. Adriana Cantwell. And if you could address the question of people thinking that because these, our children are particularly 12 and younger, not getting vaccinated, how do we break through messaging wise to help people understand just how dangerous this is for children?
Thank you, Pastor. I'm answering this question tonight not just as a pediatrician, but also as a mom. I'm a mom of a 4 and 6-year-old. And as I'm sure we can all agree, our children are our most precious resource. And unfortunately, they have had to shoulder a burden for 18 months. They've missed school, they've missed their friends, they've had such isolation, and they've been so resilient and so amazing through it all, and have adjusted to virtual learning and mask wearing and doing all sorts of things that, frankly, we wish our adults were as brave and wonderful as our children are being. And it's really quite frightening as a parent to, send off our little ones to school with no protection from a vaccine if they're under age 12, knowing that they actually can get sick. Last year, COVID-19 was in the top 10 causes of death for children. They are not immune. They certainly don't do as poorly as older people. They are getting admitted to the hospital. And with this current surge, we're seeing so many more children positive for COVID-19 requiring hospitalization. And unfortunately, a few that are ending up in the ICU with long-term complications, and just still so many questions as to how this will affect them for a lifetime. So what can we do about that? As a parent, we always want to protect our child. And so the most important thing that we can do to protect our children who are still too young to be vaccinated is to create a cocoon around them of safety. So all the adults in their lives, their parents, their grandparents, their teachers, everybody needs to be vaccinated so that we can protect them. And the other really important thing that we need to do is, if we're still, we still need to wear masks, and we need to be a good example because our children need to wear masks. And so we need to put them on and go right on through. It's the summer, it's hot, nobody likes to wear a mask, but it's what we have to do to keep them safe. If one of our children got sick, a question I ask myself is, what would I give to be able to have prevented that? So I would give anything as a mom to keep them safe. So putting on a mask, getting a vaccine, rolling up my sleeve is not a big ask. It's not too much to do to keep our kids safe. Thank you, Pastor.
Thank you for that wonderful answer. Dr. Silvers, here's a question that I have for you, sir. People have sometimes taken a kind of laissez-faire attitude towards this virus, and they may have some symptoms, and they may say, oh, it's just a little cold, or I'll just push through, it's not a big deal, and I'm going to keep on working, I'll be okay. How do you speak to that person who is taking that kind of laid-back, laissez-faire attitude in terms of what this virus has the capability of doing?
Thank you so much, Pastor. First I wanted to make a quick comment. You had asked about what the impact that this is having on hospitals of Dr. Essa, and I just wanted to make a quick comment that hospitals in our community, we have a really growing community, and hospitals are near capacity normally. Now, right now with the Delta variant and all the severe COVID illness that we're seeing requiring hospitalization, these COVID patients are taking up 20% and at times more of the hospital capacity. And that's making it almost impossible to continue to render all of the other care that's being provided to patients. Patients waiting for heart surgeries, waiting for joint replacements. It has the ability to impact all of that. So it's really an enormous impact on hospitals, an enormous impact on resources for hospitals, an enormous impact on the hospital staff, both emotionally and physically when they become ill. Regarding symptoms, I can tell you I've been taking care of a lot of COVID patients lately. And patients, this virus, just like other respiratory viruses, it takes time to build up and replicate in the system and to give you more significant symptoms. It all starts the same. And you heard from Mr. McAvoy, is that it starts off sore throat, a little bit of a cough, and I think it's allergies. Mr. McAvoy, you said that. I can't tell you how many times I've heard that. I think I just have an allergy, or I think it's just a little cold. But right now, with the rate of positivity and how much our city is on fire with COVID right now, We have got to assume that every new symptom of allergy, new symptom of an upper respiratory tract infection or cold, sore throat, cough, nausea, vomiting, diarrhea, chills, we have to assume it's COVID until proven otherwise. And the only way to know is to get a test. Now, the rapid antigen tests that are available very widely in the community, those are very accurate if they're positive. The positive predictive value of those tests is very high, especially if you're symptomatic. If it's negative, however, they're not as good. They can miss up to a third of disease and be reassuring for patients falsely. The PCR test you'll hear some people offer is a genetic test that's much more accurate. It has a much better ability to detect the virus when it's present, but even it's not perfect early on in illness. And that's why in some cases we have to retest people who are still symptomatic after a few days with the PCR just to feel more confident that they're negative. I have patients all the time that say, I just feel like I have an allergy. I just feel like I have a cold. And they're typically working for a week or more before they become more ill or lose their sense of smell and taste and decide to get tested. And then they're proven positive. Many of these people are interacting highly in the community as servers at restaurants, servers at ice cream shops, and spreading the illness. And this is just the people that are symptomatic. We know that 20% of people with COVID infection have no symptoms at all. So if you're exposed, you have to get tested. 20% have no symptoms at all. If you're exposed, you have to get tested. I think those are the most important points from blowing off, if you will, these symptoms that you can so easily assume and write off to just allergies or the common cold or a common viral infection. Right now, at a testing positivity rate of 25%, 1 in 4, 1 in 3 patients that are going through the testing lines are positive for COVID. You cannot assume your symptoms are something else. We have to assume it's COVID until proven otherwise if we want to begin to use testing as one more mode to help stop this fire within our community.
Dr. Silvers, thank you so much for that. That's extremely impactful, and I hope the community really is taking this in. I need to ask Dr. Reza another question, actually another kind of twofer in a second, sir. I think it's important that people contextualize the transmissibility, big word, right? Can you give a scenario to help with Dr. Silvers just said and others, how easy it is to be exposed to be infected? Before, people were talking about 15-minute conversation in terms of viral load and all that, but the game has changed. Can you help people really put into real understanding for themselves existentially that this is a scenario that happens, I could be infected because it's just that lethal? And then, of course, I want to ask you something else about the vaccines, when people are very reticent to take them and are questioning, the process, because it was done very quickly with warp speed. So if you could, I know I'm kind of changing the game a little bit. If you don't mind, if you could just answer those two. I think it's important for people to know just how lethal.
Of course, Pastor Newman. Thank you again for letting me speak. So this virus is different from the initial COVID-19 that we saw, something that's so much more contagious. So being indoors in closed, compact areas, the transmission of this virus or the contagion of this virus is just so much higher. So being around people, walking in hallways where it's a closed environment, you can get infected with this virus. This is aerosolized, meaning it's hanging out in the air. So just being on one side of the room with a large group of people doesn't protect you if people don't have symptoms. So that's the concern here. This hangs out in the air. So the air we breathe, that's the concern we have with this. And this is one scenario that I use for my patients. I tell them, if I have a pill that could protect you 50 to 75% of the time against all these different variants of COVID-19 that we're seeing in our world, would you take it if it had no side effects? And my patients will say yes. Well, that's what a mask provides, a well-fitted mask over your nose and mouth. Given how contagious this variant is, you want that layered protection against this virus. Get vaccinated first and foremost, but that's not going to provide us protection today. It's going to provide us protection 4 to 6 to 8 weeks out. But right now, what can we do? What can we do as a community? Put that mask on. And putting that mask on doesn't mean we shut down businesses. It's the opposite, I promise you. It's keeping our people healthy with masks on, keeps our economy going and growing. So that's the goal. Mask means keeping our businesses open and keeping our population safe. That's what we have to connect at this point. So that's how contagious this virus is, and this variant more so. And we're seeing the young in our population get infected with this virus. Thank you, Pastor.
And if you could address those who are vaccine reticent, who are saying that, I'm afraid of taking it. I'm afraid because it was fast tracked and all of those things. If you could speak to that very quickly, really.
For sure, I like using this graph here. So we've now administered 339 million vaccines across our country. And what we've seen in terms of adverse reactions to this vaccine has been about 2 to 5 per million. When you put that into terms of percentage, it's about 0.0005%. So it's markedly low. And my patients tell me I'm scared to take this vaccine. And I tell them that number. I'm more scared of this virus and what it can do to you. Please, please get vaccinated. Some of the myths that we're seeing, this was rushed. It's not safe. I'm sad to say it wasn't rushed. We had so much virus in our communities that we had many different people to run these tests on. So most trials, you do phase 1 trial, phase 2 trial, months apart, but we had so many patients infected with COVID, we were able to run these phases at the same time as one was finishing up, phase 2 was starting up. So that's what we saw. That's why it was developed so rapidly, but no corners were cut in developing this. We tested this in over 70,000 people, as well as now having vaccinated over 330 million people. It changes your DNA. That's not true. That mRNA technology is so fragile, it doesn't last in our bodies for very long to change any part of our DNA. It can give you COVID. I can say there's no live or dead portion of the virus in any of these vaccines, so it does not contain the virus. It contains egg proteins, it does not. It causes severe side effects. As I mentioned, 2 to 5 per million doses given is what we're seeing in terms of severe side effects, anaphylactic reactions. You may have soreness of the injection site. You may feel cruddy for a couple of days, but you can take Tylenol, ibuprofen as needed after you've been vaccinated. It makes women infertile. That's completely false. Our CDC has an app called VSafe where they're monitoring more than 136,000 women that are pregnant and actually monitoring more than 5,000 women. And they have not seen a difference in terms of preterm labor, any defects in the birth process when compared to prior to the pandemic. So we know these vaccines are safe. And a personal note, we waited to have our 4th child until my wife was fully vaccinated. And what we're seeing now is people that are vaccinated, that mother does transmit some of the immunoglobulins and that protection to that newborn. That's so essential, and they don't have access to these vaccines. So that's why we urge everyone, please, please get vaccinated if you're not vaccinated at this point. Thank you.
Thank you, sir. One of the things I think we have to also keep in mind is our emotional, our brain health. And there's a tremendous toll that's being taken on the community. The people who are obviously sick, and families who've lost loved ones. Personally, I lost half of my staff to COVID. We just had to have a special worship last Sunday to recognize all we lost in 2020 because of COVID. We couldn't be with them. Dr. Burak, really briefly, if you could, sir, could you speak to the emotional toll on both sides of the spectrum, to the families that are going through a very difficult, trying time, and also to those who are working in this space, the doctors and nurses, the first responders? Just if you could help us get a perspective on what that looks like and how important it is that we handle that particular issue. You're muted, sir.
Can you hear me now?
Yes.
Well, thank you, Pastor. You were very eloquent, and your question was actually an answer in and of itself. And there is a profound burden that society is bearing. And we're talking about the emotions. And so with a slight departure, I'll use my specialty, instead of talking about emotion, to be emotional. I've been involved for a long time. There's nothing more important than our health. And throughout my career, one of the things I've been significantly is ignorant. My patients say, "Doctor, what will this medication do? What's the side effect going to be?" I don't know. Will I become taller? I don't know. Am I going to have a side effect to this vaccine? I don't know. Did I know that my wife was going to have a serious side effect to this vaccine? I had an inkling, but I didn't know. Will she get another immunization booster if necessary? Yes, she will, because I want her, she'll deal with the side effect of the vaccine, but she won't deal with the COVID. But I just want to say that with all the ignorance I've had during my medical career and all of the questions that I haven't been able to answer, if there has ever been a situation in which I found myself as a physician to feel really secure about what we're talking about, it's with this situation. I don't want Joe Biden to amputate my arm. I don't want Ron DeSantis to amputate my arm. I don't want them telling me whether my wife should get vaccinated or my grandchildren should be exposed to people not wearing masks. I want to say to the community, this I know. This is real. This is lethal. And we doctors know what we're talking about. And all that has gone before has been anguishing to me when I hear the insensitivity and what I perceive as actual cruelty in telling people to not take care of themselves. So my advice is listen to, maybe don't listen to me, but listen to the other doctors. Actually, this is something that I feel really comfortable about. COVID is lethal. We are absolutely creating problems by not wearing masks, by not taking vaccines. There is nothing more important in this life than your health. Mr. McAvoy was so eloquent, but he felt a sudden loss of his being when his health was gone, and he never had that before because he's 33 and strong. Please, please take care of your loved ones. Take care of yourself. Health has nothing to do with politics. Health is above politics. Please take care of yourself. This is a serious thing, and what we're saying tonight is very important.
Thank you, sir, for those words of wisdom. Let me just recognize that we do have people from the media who are present, and we would like to hear from them. If you have a question, please be so kind to identify yourself, and please feel free to chime in now if you would.
If before we start that, Pastor, there is a question in the chat from Maria. Can someone address whether those unvaccinated patients who now are hospitalized have previously had COVID? And I'm assuming she means percentage-wise. And I think I know part of the answer is that people assume they've had COVID when they've never been tested and so on. But if one of the either infectious disease doctors or emergency room doctors would like to take that question, it's in the chat. Thank you.
I can start that one. I think Dr. Cantville also wanted to follow up. I don't have data on how many cases had a previous infection with COVID, but we're certainly seeing repeat infection. We know that prior infection with COVID, especially if you had a mild case, it doesn't seem to produce long-lasting immune benefits and protection against it. So I have certainly seen cases where people have had it before, either a documented case or not a documented case. And regardless, we still recommend that you get vaccinated because we're seeing these cases repeatedly. So Dr. Cantville, if you wanted to also chime in.
Yeah, I think a question that some people have who have had COVID and think about their long-term immunity, and they think that they don't need this. Unfortunately, this Delta variant is a game changer, and it's just so much more contagious and makes you just so much sicker. Unfortunately, the prior strains don't give you the immune benefit that the vaccine does. So if you want to really be fully protected, we need everyone in our community, especially the immunocompromised, but really everyone in our community to be protected and to be covered by this vaccine.
Thank you very much. And as I was saying before, if we could hear from our news meeting, and we encourage people, please ask questions. Please want to recognize the community. Hear from our news media. We appreciate you. Identify yourself, please. Thank you.
Hi, reporter Corley Peel with Channel 4. In regards to, getting COVID a second time, even if you've already had COVID. So what if you've had COVID before, you've got the vaccine, you're fully vaccinated? Are you seeing people get reinfected again if they've had the vaccine? Has that been common?
Dr. Reza, perhaps?
Sure, I can take this one. So what the vaccine is, it's not 100% protection against COVID-19. What it does provide is a lot of protection. Some data from the United Kingdom at this point is showing that if you've received that Pfizer vaccine, that first shot, it gives you about 33% protection against this Delta variant, but about 88% after the second week after that second shot. Now, that doesn't make it so you're Superman or Superwoman. The reality is this is a very highly contagious virus, a variant. So if you do get sick, even after being fully vaccinated, the likelihood of you requiring hospitalization, support from a breathing ventilator, or dying from this virus is markedly decreased compared to people that are completely unvaccinated. So that's the protection this vaccines provide.
But it's still a chance, even if you've had COVID before, you're vaccinated now, there's still a possibility that, yes, you could be reinfected, but you're not going to end up in the hospital, or it's not going to be as likely for you to end up in the hospital.
Exactly, Corley.
Okay.
Yes.
Corley, thank you for that. Are there any other persons from the media?
Dr. Silvers has his arm up.
I'm sorry. Thank you, sir.
Sure. I was just going to reinforce what Dr. Reza was saying. However, there are portions of the community that seem to be more vulnerable and more susceptible to becoming reinfected. There are a lot of people that take medications that suppress their immune system. So they, number one, may not develop as robust a response to the vaccine. As we get older, our immune systems don't function as well. So we know that, older age people that are not of working age, those individuals don't develop as robust a response to the vaccine. So not only do these two groups, are they more vulnerable, do they not develop as robust of a response to the vaccine, but they're also, once they are encountering the real virus, their immune systems, we've just said, aren't going to be functioning as strongly. So that's a group, people that are immunosuppressed and people that are older, that we're seeing that group being more vulnerable to becoming infected despite having been vaccinated. But the big picture is vaccination does an incredible job for most people preventing infection once it's been administered and people have had time to develop an immune response to it, and really an incredible job at preventing the more severe infection requiring hospitalization.
I'd like to answer a question that was in our chat and that ties into what Dr. Silvers was saying. When we think of our vulnerable population, we also have to think of children because they haven't had the opportunity to be vaccinated yet. So they are a vulnerable population. We had a question from Ms. Elizabeth Anderson. What impact are you seeing on children? What do outcomes look like for young children that cannot be vaccinated? And do they have similar risk for severity? Great question. Thank you for that question. We are seeing with this particular surge a big difference than we saw in the summer surge of last year or in our winter surge. We're seeing many more children who are sick, many more children who are requiring hospitalization. So they are absolutely being affected. Unfortunately, right now, the unvaccinated, which includes children, are being ravished by this Delta variant. The truth about the long-term consequences is that we really don't know yet. there's just not enough information. This hasn't been around long enough to know what could be the possible consequences. We do know that COVID causes scarring in the lungs. We do know that there are risks associated with it, like blood clots and neurological effects and behavioral and psychological effects. And we do see those in children. I mean, I've recently taken care of a baby as young as 3 weeks with COVID. So it is absolutely affecting our children.
Dr. Canfield, thank you so much for that. I don't even have words to describe, but that's what that felt like to hear about children 3 weeks old. Once again, anyone from the media, and I do want to get back to the chat as well.
Yeah, I have a question if that's possible. This is Ben Ryan with Action News Jax, just regarding the current situation and the status of the hospitals, mentioning that, kind of a mirage the past 2 to 3 weeks. Can someone speak on the disconnect of the difference between what's going on currently in the hospitals and what the community is aware of, and just again, that disconnect and how different it is, and how struggling and troubling it has been for a lot of the staff workers?
Dr. Coward, would you like to take that one?
I was answering a question in the chat. Ben, would you mind repeating that really quick?
Yes, of course, no worries. I was just saying, can we speak to the disconnect of what is currently happening in our hospitals and what the community is aware of, and how we can kind of inform more of the community, if you will. But just there's a lot of struggles that are happening, both with the patients and the staff workers. So can we speak to that disconnect?
Yeah, absolutely. I think our local media is doing a great job. I see them publishing stories on patients having to wait a long time for medical care, patients, in ICU, how long that they're waiting. But maybe everybody isn't, seeing those stories. So absolutely, I can tell you that wait times are up at all hospitals across the area. Hospitals are getting very full. Hospitals across the area are limiting visitation. So you're not going to be allowed to go see your loved one if they're hospitalized, even if it's not for COVID, because the hospital is so full and there's so much COVID that they're restricting visitors. And so if you have not COVID, but you have something like a kidney stone and you're in pain and you need to go get treatment, you're going to be waiting a longer time in pain in the emergency department because the emergency room is so full. And that's across our community, all across Northeast Florida. And so we're already at that place. And that's why we're so, urgently asking everybody to try to stop the spread of this thing by masking up now voluntarily, because we know what we're seeing is longer wait times for all medical conditions, hospitals being very full. And it doesn't matter if you have COVID or you have something else, you're going to be waiting a longer time when you come into the hospital.
Thank you very much.
I'm sorry, I don't mean to interrupt again. Just I'm going to ask just two questions in one here. Just do we think that reinstituting mask mandates will really help and make a difference? And then two, when it comes to the weekly reports, how much more effective would things be if we had them daily again?
Dr. Silvers, you want to take this one? Sorry, Pastor Newman.
Sure.
We talk about this all the time.
Yes, I'd be happy to talk about that. So, there's mask mandates, there's mask wearing. At the end of the day, do masks matter, right? I mean, whether there's a mandate or not, the question is, will masks really make a difference? Let me tell you, if masks did not make a difference, there'd be no more hospital staff to take care of patients right now. There have been so many patients in the hospital. If masks didn't matter, we wouldn't be wearing them in the operating room for our operating room procedures. And, you can think of right now, we are at a state where we have just an enormous skyrocketed population of a very, very serious virus in the population. So the prevalence is super high of the disease in the community. If that prevalence is really low, we don't have a lot of disease in the community. Vaccination, that's going to help prevent the virus from taking hold in the community. We still need vaccination because there are so many people that, thank God, haven't been touched by this virus yet, that we don't want to be significantly touched and severely ill from the virus. But once you have that disease prevalence in the community, you can't just rely on vaccine to make it quickly better, because we all know most of these vaccines are 2-shot vaccines. In case anybody's wondering, we know now with the Delta virus, one shot is not enough to make a big difference. The effectiveness is very small, 20 or 30% effectiveness. So you really need 2 shots. So we're talking once somebody's vaccinated, that's 6 weeks, 8 weeks before they really developed a robust immune response to be able to respond to the virus. Everybody in the city is not going to get vaccinated at the same time. This is going to be hopefully a gradual just rise, hopefully rapid rise in vaccination. But that's looking at benefit for our community 6 to 8 weeks out. What are the things that would have a more immediate effect at putting out this fire? That would really be the fire hose to put out this fire. It's returning to the principles of distancing, avoiding crowds, wearing masks, and identifying disease whenever we can through more testing. Mask wearing will work to help put out the fire that we're dealing with now. Distancing, identifying disease when present so that people can quarantine through testing. This is really key. One thing that I've heard some people refer to is, look, there are people that are getting vaccinated in the community, and why should the vaccinated group suffer because the unvaccinated group's not getting vaccinated? Well, let me tell you, personally, I love our community. I love everybody. I don't want to see anybody injured, and I'm not wanting to sacrifice any part of our population. So it's not okay for me to think of, just relying on vaccination alone and then let the cards fall where they may. I want to make a difference with what we know now with that very high disease prevalence. What can we do? And taking all those actions to distance, social distance, avoid crowds, mask wearing, so important, so effective, and then getting tested whenever somebody is early in symptoms. Is that an adequate answer? Does that make sense?
Yes, thank you.
If I could just briefly add, masks do not equal shutdown, and that masks actually allow us to stay open, and we want to support businesses. We want Jacksonville to succeed in every way possible. But if we have a lot of people dying, that's not good either. So the idea is wear masks, but keep everything open.
Guys, to add in real quick, I hate to interrupt. Going through this recently, just myself, after going through it, being in ICU, I'll wear 2-3 masks. It's worth it. Seeing yourself go downhill and not knowing if you're ever going to see your daughter again. It's been over a month now since I've seen my 2-year-old daughter. My girlfriend, it's been close to about the same time. And I tell you what, if it's wearing a mask or 2 masks, that will help prevent even a percentage of spreading or getting this virus, do it. Because when you're sitting there in that hospital bed and you have no contact with any family at all, trust me, you would do anything to go back and say, gosh, I wish I would have done this. So that's just my input on the mask.
Thank you for that, Prue. I think we're talking a lot about vulnerability. I know we've been on here for a while, but I think it's really critical that we address this, that one of the most vulnerable populations being affected by COVID and now the variant, the Delta variant, is the African-American community, is under-vaccinated, and the numbers just aren't good at all. And so I would like to hear from, if we could, Councilman Garrett Dennis, if you could, sir, share what you think are some of the things that need to be done to get those numbers up, to get the messaging out, to penetrate into the African-American community as to what needs to happen so we can get more people protected. If you could, we really would appreciate addressing that, please.
Thank you, Pastor Newman, and thank you to the panelists that are on here today, including Mr. McAvoy, for telling your story. I think your story is compelling, and I think it's a story that so unfortunate that it has happened over and over and over, especially in the African American and the minority community. What I see as a barrier, and what I hear in the community, is the fear of government. It's the fear of this vaccination. It's the fear that from the past atrocities of our country, things have been enacted on the minority and African American community. But I want to say today that it's real. This COVID-19, this variant is real. And we really have to get the message out and tell the story and really show the faces of COVID, like Mr. McAvoy. And again, I just want to thank you so much for telling your story, because we're going to have to come out of the shadows, and talk about our brothers, our sisters, our cousins who has been stricken with this awful virus. Because what we see a lot, on the news, unfortunately, I know we have media here, we hear numbers. And so numbers really don't tell the story. It's the faces, it's the people. And so we really have to show the face of this disease. And it's going to take, all walks of the community, from the clergy to city leaders and political leaders to the civic leaders, to really share with the community. But then it just boils down to each and every family, because of COVID, we can't gather like we used to. So it's going to take each one of us, again, expressing to our family members the importance of the vaccination, the importance of wearing masks, the importance of protecting one another, by just doing the right thing as it relates to our goings and comings. And so as a representative of District 9, representative of the city of Jacksonville, I've chosen to use my voice to share with my community, with the minority community, to get vaccinated. I did it. My family has done it, and I encourage you all to do it too. So thank you for allowing me to use my voice, on this panel.
Council, thank you so very much for that. And I'm going to kind of toss it back to Dr. Stats. There may be some burning questions that we want to address from the public, and if so, we can do that, and then I'll be happy to wrap up. Thank you for your patience. It's been phenomenal. Dr. Stats, if you could do that, that would be right.
Thank you. Thank you so much, Pastor. I did want to just offer up to any of our panelists first who have not had a chance to speak. If you would like to speak now, I want to give you that opportunity.
Doctor, this is Elaine Brown. How are you?
I'm good, Elaine. How are you?
Well, I'm doing good, but I'd like to share from the perspective of waiting outside of a hospital, waiting to hear how your loved ones are doing, and the fact that we almost lost our son last year, and then we've had just recently COVID positive and very sick people in our family. And this is so contagious. And I think that is the point that is simply not getting through to people. This is so contagious. I think that one of the doctors that was on earlier, and he said it's in the air. I cannot impress enough that you can't see your loved one in the hospital. You hope for some news on how they're doing, but the nurses and the doctors are so busy with all of their patients that this is probably the last thing they want to do is talk to people, but they do it and they do it well. It has hit very close to home. We can prevent people from dying. We can prevent people from being on ventilators and in hospitals. And I urge everyone to get vaccinated. Get vaccinated. You don't want to be sitting in a car, sitting at home, hoping to hear if your loved one is even alive. I mean, this is so serious. And I want to thank you guys so much. All of you have been so wonderful, and you've persevered during all of this. But now we've got a spike that we can hopefully prevent people from dying. I urge everyone to take it seriously and to get vaccinated.
Thank you so much, Mayor Brown. There's nothing like living it, right, Fru? Nothing like living it. And the doctors are living it every day. So we need your help. That's the bottom line. We're all in this together. Everybody says that, but It's so, so true. I think of it as if you wear a mask, you're helping your community member, your family member. If you don't wear a mask, you're helping the virus because frankly, it's out there getting better. Every time it gets transmitted, it's just a little bit better because that's how nature works. I don't know how much longer folks want to stay on. Should we keep going? Does the media have any other questions first before I look to the chat?
I have a question. I just want to know, percentage wise, how effective are the vaccines against the Delta variant?
I can take that one. So right now we have limited data on the vaccines in terms of how effective they are against the Delta variant. The data coming out of Israel as well as the UK does show that they're quite effective. This is the messenger RNA vaccine that we've seen from Pfizer. So they are quite effective, 88 to 93% against preventing hospitalizations and severe COVID. But that percentage has gone down compared to the previous variants. We still don't have enough data about the Johnson & Johnson vaccine at this point. We just need more studies on those, but they are still effective. And you have to remember that these vaccines take some time to work. So I get vaccinated today doesn't mean that I can go out and I have that immunity. It will take at least 2 weeks after that first shot and another 2 weeks after that second shot to get that level of immunity and protection.
Dr. Silvers, would you like to add to that?
Yes, thank you, Dr. Stotts. So, previously with the old version of the virus, these vaccines were 95% effective at preventing illness. So now we're seeing vaccine failure with this Delta variant. People are getting sick that have been vaccinated. Fortunately, it's very rare for somebody vaccinated to become so severely ill they require hospitalization. So that the vaccines are still making a huge impact. But people are getting sick with the virus, with the Delta virus who have been vaccinated. The numbers now, and I can tell you, I'm seeing patients regularly that have been vaccinated, and these people even more so feel like when they get sick or get symptoms that, oh, this has to be the common cold or allergy because I have been vaccinated. But we're seeing, again, vaccine failures in this group. The vaccines are still highly effective at preventing more severe illness. People need to remember, though, when we don't take actions to squash this huge fire of infection that we're seeing now, just like Dr. Stats said, if we just rely, on the vaccines for down the road and don't think of this as a multi-pronged offense that we need to go on, not just the vaccines, but these other ways that we're going to control this virus through distancing, masking, and getting tested, it's going to give that virus a chance to mutate again. So what's so ironic is that the people that just want to rely on vaccine alone, and hey, if you don't get vaccine, that's too bad. Ultimately, those people are going to get burned because it's going to allow the virus to take hold in the community among those who aren't vaccinated. And then we're going to see more variants, and the vaccine is going to become less and less effective. So the people that feel secure in having the vaccine will be left more uncovered at that point.
Thank you, Dr. Silvers. Any other media questions before I start the chat?
Really quickly, can we rely on rapid tests? You mentioned that testing is also a big part of this, not just the vaccinations, but continuing to get tested. Can we put trust into a rapid test because people want to go out and just quickly buy one or just figure out a way to get it as soon as possible? So how trustworthy is a rapid test?
Wants to take that.
Dr. Silvers, you talked about this a little earlier, if you want to reiterate.
Sure, I'd be happy to talk about it. So just to remind everybody, there are two primary types of testing that you can see out in the community. One is called a rapid antigen test, and one is called the PCR. The PCR is actually, another word for that is nucleic amplification test, okay? And what that's looking for is genetic material. And so that test is a lot more sensitive. It can pick up more disease when it's present. So the early in illness, that even that test is not as perfect, but we think of the PCR test picking up disease about 90 to 95% of the time when present, as opposed to the rapid antigen test that can miss disease when present a third of the time. So that's called sensitivity, the ability of a test to pick up the disease when it's present. The PCRs are much better at doing that, 90 to 95%. And the rapid antigen tests in the 65% range, missing about a third of the disease. One thing that's very important to note, though, is that even the rapid antigen test, when it's positive, that positive predictive value is very high, close to 98, 99%, especially if people are symptomatic and not just doing it for routine testing without symptoms. So any test positive, think of it as a true positive. It's highly, highly likely to be a true positive. But you cannot rely on a rapid antigen test negative to tell you that you don't have the disease.
Especially if you have symptoms.
Especially if you have symptoms. That's a higher risk group that's more likely to have the disease to begin with before you test.
Dr. Stotts, before you get back, one thing I think is important, we manage expectations. You mentioned earlier that we don't have a lot of good news, right? Can maybe Dr. Silvers, Dr. Reza, or whomever address what does the next 6 to 8 weeks look like from where we are now? What should we expect? Is manage?
It depends. It depends on all of us here and everyone in the community, really, truly. But we know that cases precede hospitalizations, which precede death. And we already have the cases. So we can't go back from there. I wish we could. It's not good.
Dr. Reza, Dr. Silver?
Yeah.
Yeah, I agree with Dr. Satz that some people are like, we're not seeing people die from this virus, but from when somebody gets infected to requiring hospitalization, and if the unfortunate event happens where you pass away, we're looking at 6 to 8 weeks. So this surge that we've seen over the next 2 to 3 weeks, the number of unnecessary lives we'll lose is just heartbreaking to me, because this is now preventable. These vaccines are so effective. So, but we can still make a change today. We can make a change today. That's what we're reaching out to you all. That, wearing that mask, a well-fitted mask, will decrease the level of virus that we're circulating within our communities. And getting vaccinated will also overall decrease how much transmission is having and how many lives are being touched by this deadly virus.
And I haven't seen any predictive graphs, any predictive analytics that haven't shown anything but just a slope that goes almost straight up for what we're expecting in the coming months. So there's really no prediction groups out there that think we are getting on top of this. We are not on top of this virus yet in the city of Jacksonville or the region.
Thank you. Dr. Stotts?
So just quickly, there's a question about testing sites where it's free. Now, none of us are necessarily, addressing the finance piece of it, but I know CVS, for example, has drive-through testing. Mayo Clinic has drive-through testing. If you Google, where can I get a COVID test, you should be able to look into that. And if you're having symptoms, by and large, your insurance should cover it, is my understanding.
Absolutely. Walgreens, CVS, in 24 hours, they'll get you a test back right away. So
I did put in the chat box www.vaccines.org. That is the website to go on to find out where to get a vaccine. And you can choose which of the 3 vaccines you prefer. If you decide I really want X vaccine, but not Y or Z, you can click on that, put in your zip code, and it will tell you where available vaccination sites are. It's very user-friendly. Importance of the mask, I think we've covered that. Best recommendations regarding school districts. I think there's going to be a lot of talk about that with school starting in a couple of weeks. And I wonder if we should perhaps have another, get together to discuss that topic among any other things.
Dr. Stotts, Dr. Campbell was saying there's a lot of pediatric questions.
Okay.
And she's happy to answer those too.
Sure. Go right ahead, Adriana. Thank you.
So I've seen a lot of great questions in the chat. Should we be sending our kids to school with masks on? From the teacher's point of view, are they safe if they've been vaccinated? Very good questions about the adolescent age group and the risk of myocarditis with the vaccine. So lots of really great questions. One thing that I do want to share, because I think it really shows more than anything else how much I trust the science and how much I trust these vaccines. I participated in the Pfizer trials. as did my husband, and our daughters enrolled in a vaccine trial. These vaccines are incredibly safe, and they do so much to keep us safe and to protect us and to protect our kids. With regards to wearing masks in schools, the American Academy of Pediatrics, our biggest and most important group for pediatricians and for taking care of kids, has absolutely recommended that they be wearing masks in school. I can't tell you if it's going to be a mandate or not. I'm not a politician. I am a mom, and my kids are going to be in masks. I hope that everybody puts masks on their kids, because that's really how we can keep them the most safe. We want them in school. We want them learning in person, not virtually. And to do that, to keep themselves, their teachers, all the staff at their schools safe, everybody needs to be wearing masks, including the teachers as well. And to quickly address the concern about the safety and the myocarditis, which is the inflammation of the heart that we've seen in association with the vaccine, it is much more likely to be a consequence of COVID-19 disease. It is a much more common thing that we see associated with the disease than we see with the vaccine. The rates of myocarditis are not significantly different than we see in the general population to be associated with the vaccine, and it is associated with lots of virus. There's been no long-term consequences. The kids get back to normal. Their hearts return to normal with the myocarditis associated with the vaccine. So if that's a question, I'm not going to be able to answer everybody's questions, but I urge you to get your information from a good resource. Talk to your pediatrician. Pediatricians love talking about vaccines. We're not new to people who have hesitancy with vaccines. So please go to a trusted resource, the American Academy of Pediatrics, your pediatrician. Nobody's going to want to take care of your child more outside of your family than your pediatrician. So please have those conversations with them if there's any further questions.
And it looks like, Corley, you have a question?
Hi, yes. So, right now a big, hot button issue is if schools should require students to wear masks. Would y'all recommend that all students inside the classroom wear masks?
Who wants to take that question?
Dr. Campbell, you want to take that one?
Yeah. So again, our children, especially those under age 12, are vulnerable. They haven't had the opportunity to be vaccinated. I know all of the parents with kids under age 12 are counting the days and waiting for that data to be submitted and for it to be approved. So many people want to get their younger kids vaccinated. They haven't had the chance. So we have to keep them safe. This is the best way to keep them safe. And it's what the American Academy of Pediatrics has recommended, that not just the students, but everybody in the school. So the teachers, the staff, whether the staff and teachers have been vaccinated or not, that's the recommendation. I can't speak as to whether it will be mandated, but it is absolutely what we should be doing for our kids.
And some of this has to do with as the other doctors mentioned, the endemic level in your community. Right now, we have 1 in 4 people testing positive. So that is dictating our recommendations right now. That's not to say they couldn't change down the road.
Dr.
Absolutely.
Campbell.
This doesn't mean we need to be wearing masks the whole school year. But for right now, with the way the rates are right now, we absolutely need to.
Dr. Canville, maybe you could comment just briefly. I've heard some people say, you can't breathe through a mask and you're inhaling toxic fumes when you re-inhale your exhaled air. Could you comment on that?
Yeah, absolutely. I mean, I think one of the best testaments to that is we don't see doctors passing out in the operating room when they're operating for 10, 12 hours. They're doing it just fine and their brains are working brilliantly. But we've seen, I think everybody's seen YouTube videos where somebody has a little pulse oximeter on their finger while they're wearing a mask, while they're doing a Peloton ride, while they're doing stuff. And the masks do not prevent you from breathing appropriately or having an excess of carbon dioxide in your body. They just don't do that. That's just not based in reality.
That's good. Dr. Stats?
Okay, so I think we've covered most of our chat questions. We had fabulous questions. There was a question about shortages in the hospital. The sense I have is that the staff is one of our most precious resources, and it's not an unlimited supply. Once You have used all your ICU doctors and your respiratory therapists. It's fairly easy to get more ventilators, but getting more people to come and work is difficult. So as a community, that's something we need to keep in mind, that it's a precious resource, and we can't keep stressing it so hard. So I'm going to wrap this up now. I'm going to ask Dr. Pastor to have, or I'm sorry, Pastor Newman, to perhaps close things off with something slightly hopeful. If you have anything hopeful, I know I really appreciate all these panelists for coming. I appreciate all of you for signing in. We want COVID to be done. We're over it as much as you are, but it's not over us yet. So we really appreciate you listening.
Thank you so very much. Before I do that, if Dr. Reza, have you put it in the chat, or you could mention, what's that data point for getting the best information? You mentioned it in your presentation earlier, a website that people could go to find out what the data is in Florida. If you could just...
Yes, it's covidactnow.org. It's a nonprofit organization. It's bringing in data from the CDC, from the government. So those are trusted sources where you can get some of these data points. Okay. covidactnow.org.
Thank you, sir.
I'm typing it in the chat right now.
Thank you, Dr. Stacks. Well, thanks to everyone who's participated tonight. It's been a phenomenal, I think, an incredible event. And the chat has only continued to grow. That's saying something about our community's interest tonight. And so this has been a wonderful thing. There are a lot of things we can live without, but we can't live without hope. And we have to recognize that our hope is inextricably tied to one another. That we cannot be isolationists. We cannot be separatists. We have to be in this thing together. I mentioned earlier the common good. We have to look out for one another and love one another. It doesn't make any difference what your political stripe is. COVID-19 doesn't care whether you are conservative, whether you're progressive, whether you're liberal, whether you're gay, whether you're straight, whether you're young, whether you're old, whether you're black, whether you're white. It doesn't care what your ethnicity is. There's only one race, that's human, many ethnicities. But the most important thing we recognize tonight is our hope is in one another, looking out for each other, fighting the good fight for the common purpose of beating this disease. And we can do that if we continue to have hope. And I just hope and pray tonight that you come away with this, getting the facts, getting the truth. And right now it's kind of ugly, but that can be turned around if we embrace hope, embrace one another, and think more highly about others and not just only ourselves. That will help us make a tremendous difference. And I'll tell you, for me personally, I'm hopeful tonight. I believe that this conversation, and Fru, man, you have just knocked it out the park for all of us tonight. You set the table for what we need to do. And I hope and pray we all take responsibility and take this seriously. And let's keep hope alive, because together we can beat this. And whatever we think we gain by not being together, we lose tremendously because we're not united. So let us fight this good fight, keep the faith, and God bless each and every one of you. Thank you so much, and good night.
Thanks, everyone.
Thank you, guys.
Thanks.